Now, one of the things that Kerala, was among the early states that got it. If you're currently the health minister, what would be the 3 or 4 things you've been doing or will do to ensure that firstly, speedy reaction is there. Secondly, you've got the facilities. One of the things that happens post-pandemic is everybody relaxes. Masks are off, you start shutting down all the hospitals, the beds are gone, the oxygen is somewhere around their place. What is it that you have to do to keep crisis management going?
Yeah, it's not time to relax. Actually, right. See, this post-COVID ailments or illness, they are the real threats.
Right.
See, the post-COVID syndrome. And we are seeing multiple, or they are affecting the multiple organ system.
Right.
And the second thing is the antimicrobial resistance, which impacts, it's fueled by this pandemic.
Right. Like TB drug resistance, you now have a COVID drug resistance built up, is it? Is that what you're talking about when you say antimicrobial?
See, it's I'll tell you about one drug, it's azithromycin. See, when you analyze the situation in India, the most sold drug in India during this pandemic time is azithromycin.
Right, of course. Yes, so, everybody said take it.
Yes. Yes. So this is it's usually referred as a silent pandemic.
Right.
This antimicrobial resistance.
All right. Wow.
So we really have to work hard on this antimicrobial resistance. Yeah. It's a real threat.
No, that's a very good point. A lot of us overdrugged ourselves. A lot of doctors even if you just had the fever, they would say, take this as a precaution. Yes, I remember the first wave, my doctor was very nice. He told me, don't touch it. Don't take anything, just take crocin, make sure for the 4th day. And I was almost on the 4th day, I said, I have to take it because, I was feeling weak. He said, no, don't, wait. And the fever went after that. So, yes, I get it, yes.
For not going to the hospitals to avoid hospital visit or hospitalization, what people used to do, they go to the pharmacy and they...
Right.
So that's the thing. So this is a real threat. And the third one is a mental health crisis. That's a very, very, very important thing. And of course, what Kerala has learned, if you ask me a single point to point out, we have realized, of course, that we have to reduce the morbidity. Even though the health indices are very good, the real challenge is the lifestyle diseases.
Right.
So diabetes, hypertension, etc. So what government of Kerala did, we have evolved a Shaili app. It's like a home screening. We do home screening for all population above the age of 30. And then we are trying to find out if they have any lifestyle disease, or if they have any lifestyle disease, or whether they are undergoing any treatment. And we are also analyzing the risk factors. So that we are doing.
You made this very interesting point about the COVID impact. We think we've got over the virus, but you're saying there are a whole lot of cases that have been impacted, whether neural, whether your heart or your things are beginning to show up now, the post-COVID, sufferings that are happening. How serious is that in Kerala? And you're the health minister, you must be getting statistics all over. Would you call that, as you said, the silent pandemic, a new silent pandemic where you're getting all the after effects of COVID?
Globally, the health experts refer this AMR as a silent pandemic. And Kerala, what we did is that we started post-COVID clinics across the state, 1,118 clinics, and we have a 3-tier system. First tier includes the family health centers and the community health centers. Second tier includes the taluk hospitals and the district hospitals. And of course, the third tier includes the medical colleges. And in these clinics, what we try to do is rehabilitation. So it's nutritional rehabilitation, psychosocial rehabilitation, cardiovascular rehabilitation. So all these things are done in the post-COVID clinics.